Hello. Today we're going to talk about the cardiovascular responses to endurance training. I strongly recommend that following this video, you read an article by Yilva Helston entitled Cardiovascular Adaptations to Exercise Training. It was in 2016, published in Comprehensive Physiology or something like that. So first off, we're going to talk about central adaptations, so how the heart and cardiac output adapt to endurance training. Then we'll talk about peripheral adaptations, how the vasculature adapts. So what's going to happen with endurance training to the central circulation? Whenever you think about changes to the central circulation, our natural inclination is first think about heart rate because it's just so easy, right? And you know that with endurance training, heart rate goes down. But heart rate is not the target. It's not what your body is really regulating. It really cares about cardiac output. So remember, cardiac output is the product of heart rate and stroke volume. Cardiac output is what your body cares about. So let's see what happens to cardiac output with endurance training. So this comes from the paper by Helston. They are showing the heart rate at, let's say, a VO2, submaximal VO2 of about 2 liters per minute. This would be like 150 watts on a bike, maybe 200 watts. So not too hard for most of you. So for an untrained person, that would elicit a heart rate of about 150 beats per minute. For a trained or elite level person, it would be a lower heart rate. So you might be thinking, well, they can get by with less blood. That's what happens with endurance training. But no, it's not. Look at cardiac output. Cardiac output is roughly the same for all three groups: untrained, elite, endurance trained, same cardiac output. So why is the heart rate different? Because the stroke volume is different. The endurance trained individuals, whether elite or just normally trained, they have a greater stroke volume. And so if stroke volume is higher, now you can get away with a lower heart rate and maintain the same cardiac output. Ejecting more blood per beat is much, much more efficient for your heart. It costs it less energy than ejecting more blood by increasing your heart rate. So it's much better to increase cardiac output or maintain a cardiac output with a higher stroke volume. So now the question comes up, why? Why is stroke volume increasing with endurance training? So let's look at our equation. You guys have seen this before. What factors affect heart rate and stroke volume? So heart rate is going to be impacted by sympathetic, parasympathetic activity. Let's focus in on stroke volume. Okay, so stroke volume is going to be influenced by the contraction strength. That's what we would call contractility of the heart. And diastolic volume, which we will say is influenced by preload. And mean arterial pressure, which we'll say is influenced by afterload. So let's look through these things for a little bit. What is happening to sympathetic activity and afterload with endurance training? So here in a couple of studies, this has been shown multiple times. This shows sympathetic nervous system activity. So during exercise, so what they do is they put a little electrode in the muscle, and they can measure how quickly the sympathetic nerves are firing. And so this is showing that the sympathetic nerve is firing at about 30 times per minute when an untrained person is doing a certain amount of knee extension exercise. When a trained person does that same amount, or the same people after they're trained, now they have less discharge of those sympathetic nerves. So that would mean less epinephrine, less norepinephrine going throughout the body. And so lower sympathetic nervous system activity at rest and during submaximal exercise. So what's that going to do for us? Well, it should help decrease our afterload. Remember, sympathetic nervous system activity is going to cause vasocontraction or vasoconstriction of the arteries in the periphery, particularly in the muscles. So if we have less sympathetic activity, we have less vasoconstriction, that's a lower blood pressure or lower afterload, so we can eject more blood more readily. The sympathetic nerves will also be firing less during submaximal exercise on the heart, and so it won't have as much of a signal for contractility. But because of several other things improving the contractility and the stroke volume, it's not going to have too much of an effect there. This is all submaximally, right? If you get up to maximal exercise, your sympathetic activity is going to be through the roof, no matter if you're trained or untrained. It's stressful no matter what. All right, but what about preload? So we've talked about mean arterial pressure, we've talked about sympathetic activity, but the big thing here that's going to influence stroke volume is going to be end diastolic volume, or preload is going to influence a lot of that. End diastolic volume is just how much blood there is in the ventricle right before it starts to contract. So one of the things that's going to influence preload, well, before I say one, let's just go through them, right? So what factors influence preload, right? So you have another name for preload is venous return. So what influences venous return? You're going to have venoconstriction, the muscle and respiratory pumps, we'll just call those the peripheral pumps, and also blood volume. So with increased blood volume, you can push more blood back to the heart, and also that blood volume will help you have a higher end diastolic volume. So preload influences end diastolic volume and also just blood volume on its own. The more blood you have, the more you can fill the heart. Hopefully that makes sense. So what happens to blood volume with endurance training? Well, blood volume increases rather quickly with endurance training. So if you go from untrained to trained to elite level, you can see changes in blood volume. And that's whole blood, right? So that's going to be the combination of the plasma, the red blood cells, and all the rest. What about red blood cell volume? So that's going to show up here as the erythrocyte volume. And that's going up with endurance training as well, right? But not quite as much as the plasma volume. Plasma volume goes up even more. So with endurance training, you're going to have more red blood cells in your body, and that's going to allow you to carry more oxygen. But at the same time, you're going to have more plasma, and the plasma increases slightly more. And so the ratio of red blood cells to plasma tends to go down a little bit with endurance training, not a ton, but a little, from about 45 to let's say 43 or 44. So just a little bit. But the big thing here is that you're increasing how many red blood cells you have and how much plasma you have. And those both, the red blood cells, important for carrying oxygen. The plasma is important for carrying everything else, especially like diverting blood out to like the skin to help you dissipate heat without sacrificing too much blood flow to the muscle. So increase in blood volume, that's a big deal with endurance training. What about the size of the heart? So end diastolic volume, I could probably just go here. End diastolic volume is going to be influenced by preload or venous return, and also just the size of the heart, of the ventricle. So the bigger the ventricle, the more you can load it and the more you can eject. So what happens to the size of the heart with endurance training? This is a very key adaptation that this will take a while. The changes in blood volume, those can be seen within just a couple of days of starting endurance training, especially the plasma volume really changes very quickly within a couple of days. But the heart, it will adapt over time. Now, in previous lectures, we've talked about how the heart is a pump, and I compared it to like a bike pump, right? So in here, you would fill the reservoir with air, and your cardiac output would be the product of how much air you push out with every stroke or every beat, and then how many times you beat it per minute, how many times you move the pump every minute. So with endurance training, we're going to get a bigger pump. So we get something called eccentric hypertrophy. Eccentric means away from center. And so the heart is expanding outward. And that means you can fill it with greater volume. And the more volume you have in there, the more you can eject out. So endurance training over time, a couple of months, you'll start to see this outward remodeling of the heart where it tends to get bigger. Now, if you do something that's overloading, putting a lot of afterload, especially chronically afterload on the heart, like hypertension, that's going to cause concentric hypertrophy, or where the heart remodels inward and you get much thicker muscles, heart muscle, and less volume. So this very clearly happens with hypertension. There's some evidence that suggests that with chronic strength training, it might happen, but it doesn't, I don't think it's too big of a concern with the strength training. So you're going to have a bigger pump, and that's going to allow you to eject more blood for every beat. So let me go back to this here. So far we talked just about the submaximal stuff, right? So because you have a bigger heart, you eject more blood every beat, so you can get the same cardiac output with much fewer beats per minute. But what about maximum cardiac output? This is one of the main differences between an untrained and an endurance-trained individual. Endurance-trained individuals can hit a much higher cardiac output than untrained people. So the untrained person might be hitting somewhere around 20 liters per minute, where you get your elite level people pushing 35, 40 liters per minute. So how does that happen? Remember, cardiac output is the product of heart rate and stroke volume. Does maximum heart rate go up with endurance training? The answer is no. If anything, it tends to go down a beat or two. So you're not going to increase your cardiac output, your maximum cardiac output, by increasing heart rate. So it must be because of stroke volume. So what factors are going to allow you to have an increase in stroke volume? First off, you have a bigger ventricle, right? So the untrained person can only fill up that ventricle so much until it's completely full. If you have a small ventricle, you can only fill it up, let's say, in this case, like your untrained person, you can eject out 125 milliliters per beat. But that endurance trained individual, elite level especially, they have a bigger heart, so now they can maximally eject about 200 milliliters per beat. So one of the things you'll see with stroke volume and exercise intensity, if this is intensity of exercise on the X and the Y is stroke volume, an untrained person will max out the size of their stroke volume pretty quickly into an exercise. So when they hit about 40 or 50% of their VO2 max, they've already maxed out their stroke volume. It can't get much bigger. But with an endurance trained person, because they have a bigger heart, they can keep filling more and more and more until really, if you're at an elite level, you might not even reach a plateau in your stroke volume. You might be able to keep increasing it because you have a really big ventricle, right? So stroke volume is a key adaptation with endurance training. So how quickly do these things happen? So here on this axis shows the duration of training in months, and then the y-axis is the percent adaptation in multiple things. This change in blood volume happens really quickly. As I said, you can see changes in blood volume, especially plasma volume, within just a few days. Now, the changes in stroke volume and left end diastolic volume and all of that, these things will take a little bit longer. So here is left end diastolic volume. It's gradually going up over the course of several months. So that means that the remodeling of the heart to get bigger, it takes a while, right? Now, here's just another look at the heart. So the heart is a muscle, just like, well, not exactly like your skeletal muscle, but it changes in size. It can atrophy or hypertrophy, just like skeletal muscle. So with exercise or pregnancy, you can get a bigger heart. What happens in normal physiological hypertrophy, what we would call eccentric hypertrophy, is that you get a thicker wall, but that the wall thickness increases in proportion to the increase in volume. So you're getting a bigger volume of the heart, and at the same time, the thickness of the wall is going up about the same proportion. So everything stays roughly the same ratio of thickness to volume. And that allows you to eject a lot more blood. In pathological hypertrophy, this is something that you'll see with chronic hypertension. Now the wall, because the heart has to generate really high pressures and contract really hard against a high afterload, the wall hypertrophies inward, so it gets really thick, and it gets much thicker than then the ventricle gets bigger. And in fact, the inside of the ventricle, that volume is going to decrease because it's an inward remodeling. So now you have a really thick ventricle with a really thick wall with a small hole in the inside, or a small volume. And so the stroke volume goes down with these pathological hypertrophies. Now, unfortunately, in the cases like hypertension and other cardiovascular diseases, this increase in muscle size is usually accompanied with atherosclerosis and coronary artery disease, right? So you don't just get hypertension for no reason. You got bad arteries often, and those bad arteries are also in the heart. And so they have a hard time maintaining or perfusing all of that extra muscle. And so it tends to die off. And if this happens long enough, if it's persistent, you can see the walls get ridiculously thin and weak. And now you have a really thin wall. And these little gray things that I'm highlighting with the red, that's like fibrotic tissue, so non-contractile tissue. So you got this heart that doesn't have a lot of contractile tissue in it, and it can't contract or eject blood, and that would be a problem. So this is what you want. But keep in mind also your heart can shrink. Okay, so bed rest, weightlessness, if you ever go to space, detraining, these things will cause the heart to adjust or shrink, get smaller. All right, now what about the peripheral adaptations? So we've talked about what happens to the heart. What happens to the vasculature? So VO2 max is influenced by blood flow, right? You have to be able to deliver blood and oxygen to the muscle for it to consume it. And VO2 max obviously goes up with endurance training. So does blood flow increase? And the answer is yes. Blood flow, muscle blood flow especially, increases quite a bit with endurance training. So first, let's look at maximal intensity, maximum blood flow. So here's the max blood flow of an untrained person during knee extension exercise. Here's an endurance trained person. They're getting a lot more blood down to that active muscle than the untrained person. So blood flow goes up, maximum blood flow. But what about submaximally? This one kind of, it might surprise you. So here, this white bar, the white boxes is blood flow. So submaximal blood flow. So let's say we're having you just cycle at 50 watts before and after training. The blood flow at 50 watts, which is pretty light, might go down with endurance training. Now, part of that is probably related or potentially related to that slow component. Remember, if something's difficult for you, if you're above lactate threshold or critical power, you'll see this gradual slow component or fatigue, and your muscles will be less efficient. And if they're less efficient, they need more blood, more oxygen. And so you'll see greater blood flow if you're untrained at a given intensity, submaximally. So endurance training, you won't have as much of a, following endurance training, you won't have as much of a slow component. And so you won't need as much blood flow. And there's also potential that you don't require as much blood flow because you're recruiting primarily type 1 fibers now, or more type 1 fibers, and they're more efficient with the blood flow also. All right, so why does blood flow go up? Maximum blood flow. Let's focus in on maximum blood flow now. So why does maximum blood flow go up with endurance training? So remember, blood flow is the product of the quotient of pressure and resistance. So the difference in pressure, this can change a little bit, but the main thing that's happening is that you'll see less resistance. And resistance is the quotient of length, viscosity over radius. Now the length and the viscosity aren't going to change all that much, but radius, the radius of the vasculature, will adapt with endurance training. And even small adaptations in radius, because it's raised to the fourth power, will have profound impacts on your blood flow. So why does the radius increase? And when we're talking radius, it's not just the radius of a single capillary or a single artery. We're talking the radius of the whole vascular network that's relevant to that exercise. So the radius of that vascular network is going to increase because you'll see an increased number of capillaries and sometimes resistance arteries in that relevant muscle, right? So if you're doing cycling exercise a lot, you'll see increased number of capillaries and resistance arteries within the legs. So here is the capillary to fiber ratio. So how many capillaries are surrounding every muscle fiber in the quad before and after endurance training? And you can see that with endurance training, you get more capillaries per muscle fiber. And if you're an elite or a higher trained person, you get even more, right? So more capillaries, that's also going to often be accompanied by more resistance arteries, and you just get a much greater vascular network, a greater radius, so less resistance, greater blood flow. Another thing this is going to help with that I just want to point out right now, having more capillaries per muscle fiber is also going to help with gas exchange or diffusion, and we'll come back to that in a second. So not only do you have more capillaries and potentially more resistance arteries, but your ability to dilate your arteries, especially those resistance arteries, is enhanced with endurance training. So here's a study that we did, or a summary of several studies that we've done in the past, where we look at nitric oxide's ability to dilate arteries in the muscle in different populations. So we move a leg back and forth, and that causes the arteries to release nitric oxide and increase blood flow. When we do that, in young, active, endurance trained people can increase blood flow a lot. And people who are just young and sedentary don't increase their blood flow as much. We've also done studies that when we take a sedentary young person or a sedentary old person, endurance train them, their ability to increase blood flow from leg movement is increased. What that means is their ability to dilate their arteries is increased. So not only do you have more arteries, but your ability to expand them also increases. And that's probably related to greater availability of nitric oxide and other vasodilators, and potentially related to less sympathetic activity, which would cause vasoconstriction. The improvement in nitric oxide and other vasodilators is also going to help you have better oxygen delivery. So sometimes you can have a lot of blood going down through the big conduit arteries, like your femoral artery, but that doesn't necessarily mean it's making it to the muscles that actually want the blood flow. You might have a lot of waste going out to muscles that aren't active. And so by having better vasodilation, you can potentially improve the delivery of the blood and oxygen to where it needs to go. Now look back at this chart. So this in the white bars shows the blood flow, and the hashed bars, this is the AVO2 difference. So why do we care about that? Remember, VO2 can be calculated as the product of cardiac output times arterial venous oxygen difference. So endurance training can lead to better AVO2 difference. This isn't showing up here too well, but let's say, yeah, just ignore what I was just talking about. I'll talk about it in another way. So with endurance training, you can have better diffusion and an increased oxygen extraction. Oh, that's how this shows up. So I guess it does show up here. So during maximum exercise, your endurance trained person can get a greater AVO2 difference. So let me write that out again. VO2 is equal to cardiac output times AVO2 difference, okay? And so that AVO2 difference, that increase can be because you you're extracting more. You have greater diffusion. It's easier to diffuse the oxygen across the capillary. Or it could also be because you're delivering the blood to where it needs to go more accurately. You're not delivering blood to inactive areas where they're not going to extract oxygen. So by having more precise delivery of oxygen, you can see a greater oxygen difference or a greater extraction of the oxygen from the blood. That brings us to diffusion. So what's going to impact oxygen diffusion? Let's go back to Fick's law of diffusion. We talked about this in the context of the lungs before, but the same concepts apply when you're trying to diffuse oxygen across the capillary into the muscle. So things that are going to influence it are the gas that you're trying to diffuse. In our case, we're looking primarily at oxygen, and how easily oxygen diffuses, the properties of oxygen is not going to change with endurance training. But things that are subject to change are going to be the area for gas exchange, the membrane thickness, and the pressure difference. So the pressure difference, this would be like, let's say this is the blood over here, and this is the muscle over here. That would be the pressure from here to here. So endurance training isn't really going to increase your pressure to make you have a bigger pressure in the blood than you would before. So you still have like that same pressure, but endurance training, you might be able to extract more oxygen out of the muscle. So you have a slightly lower pressure of oxygen in the muscle and the mitochondria. There's not a lot of evidence for that at this point, but it could happen. There's some that suggest that. It's not going to be the biggest impact. Really, the big thing that's happening is the area for gas exchange will improve with endurance training. So what's the area for gas exchange? It is not just the capillaries, all right? So let's say here's like a cross section of a muscle, and you're going to have capillaries around it, all right? So one of the things that we've talked about already is that you get angiogenesis with endurance training. That means you would go from having, let's say, 1 capillary or 3 capillaries around that muscle fiber to now 4 capillaries around that muscle fiber. That itself, if you just have more capillaries, it's not going to improve diffusion. Those capillaries have to be full of blood. So you need red blood cells in here. It has to be perfused. So the area for gas exchange is not just capillaries. If there's a capillary that's not in contact with the muscle, it does you no good. The capillary has to be in contact with the muscle, and that capillary needs to be perfused with blood. Now, this is going to go beyond the scope of the class, but your capillaries, even at rest, all of them are going to be perfused with at least a little bit of blood. They're not completely turned off. But one of the things that happens with endurance training is that you can cram more red blood cells into the capillaries. Because of better vasodilation upstream, there's a lot of weird stuff that happens with the fluids, but the end result is better vasodilation upstream results in a greater hematocrit or greater concentration of red blood cells in those capillaries. And that's the interface the area for gas exchange that we're concerned. The interface between red blood cell and muscle, essentially. All right, so if you can cram more red blood cells into your capillaries, that's going to give you a greater area for gas exchange and facilitate diffusion. So this is one of the major things that's going to help you have better gas exchange at the level of the muscle. One other thing that might be a factor is the membrane thickness. So let's say that I only have 1 capillary. If I need to get oxygen from here all the way over to here, that's a long diffusion distance. So if I have another capillary that grows and I now have a capillary, now the diffusion distance is much shorter. So that could help the diffusion or the rate of diffusion. At this point, most evidence says that this diffusion distance is not a huge limitation or even in untrained people. So the bulk of the evidence points towards diffusion being enhanced by that enhanced area for gas exchange. All right, so now at this point, we've talked about the central and the peripheral adaptations that occur with endurance training, and I strongly encourage you to go and read the article by Helston in 2016 entitled Cardiovascular Adaptations to Exercise Training.